What's up, y'all? Episode 9, the Merce and Nurse Show. It has officially been 9 weeks. 9 weeks, guys.
9
Holy
weeks.
crap. It took me long to do math. Well, thanks for being here. Like I said, it's the Merce, Noah with the nurse.
Barbara in our kitchen.
In our kitchen, doing our stuff after a Good Friday service at church.
Mm-hmm.
It is almost 9 o'clock right now. It's going to be 9:30. I got to work tomorrow. She's off tomorrow.
Good Friday.
But we want to do this for y'all. We want y'all to enjoy the stories we have.
We have good stories today.
So pretty much, I want to just see what happened this week.
Yes. We're going to do a review from the week of a nursing student slash...
Of hell.
Yeah, of hell.
No, it's really been a hell. It's been a hell week for me. So
not me. I got a new job. I like it.
Yeah. So how's it been? So what's been going on with you?
Well, I've already been in my job 5 weeks, and I like it because it goes by really fast. Working at the jail nursing, prison nursing. You know, you always hear.
Yeah.
It's very different, but it's like I got out of a slow car, bumper car, and I got into a Maserati, and I just, all the stories and stuff I see, I'm like, it's different.
I bet you it's like a shell shock, like coming from a nursing home, going into like the jail system, and you're like, oh my God, what is going on?
I'm like, oh my God, everyone is in here for drugs.
That's crazy though, right? A lot of it is. It is a lot of it.
Yes.
So like, have you seen or heard any like crazy things? So because you know what we hear about in the movies, right? Like people making contraptions or making their own food or ways to get a high, or how they like they make tattoo. You know how they make tattoo ink? It's like they burn a candle and like they capture the soot on top and then they use that soot. Yeah, for tattoo ink. So have you heard anything like that?
Yeah, and like I said, I mean, there's never no names, and it's stuff like because I love to watch documentaries. I watch numerous documentaries on Netflix, jail from the young juveniles and stuff.
The first not first. Yeah. What's the one? Scared Straight. Scared Straight. Yeah.
So I'm just gonna tell you something that I like in my mouth because I'm just a newbie. I'm green. What do they say? Wet behind the ears. I'm sure. Like I don't like when you're wet behind the ears of your job. It just
who says that?
It's the old saying, like she's wet behind the ears, basically saying she don't have no experience.
She goes swimming?
She don't know. They've always said that. Okay. It's showing my age. Long story short, I found out today that I'm just gonna say it.
Just say it. What?
So I found out from one of the correction officers. Because they go and they do sweeps of the rooms, right?
Okay.
And you have to do that. And even though we're like a low-level jail, but still. But, when you have addictions, nicotine, cigarettes.
Yeah, for sure.
Okay. They say that is the most addicting.
It is. It was funny you say that because like I was reading a little article. It was saying that it was this question. It's like, do you know what is the most addictive drug that's also legal?
Yeah, and you want to say, you're thinking... weed I was thinking weed, right? Because most places are like making it legalized, right? But no, it is nicotine. Yes.
Nicotine is super, super addictive.
It is. So long story short, like I said, I mean, you put in for a sick call, whatever, you have, aches, pains, you get some rub, you get, fungal cream, whatever you need. Yeah. You can get it if you go to the doctor and it's all like legit, we're nurses, it's whatever. So one of the SOs brought
the who?
Like a correction officer.
Okay.
She brought this. It was a CO. This tube of like Bengay but generic muscle rub, right? Because hey, you got aches and pains too.
Yeah, for sure.
And she was telling us, I found this, but she's real nonchalant. She's seen it all. This girl, I've seen it all there, and many years. And she's like, she was like smoking it, and I'm thinking. How do you smoke?
You smoking Bengay?
And, like a rub. It's like a rub.
Yeah.
Okay, and I'm just going to be blunt. I mean, I just want to laugh. So, like, from a tampon, the carton, because they're not the Playtex plastic. They're the, you get what you get. You don't throw a fit type. And
Okay, okay.
I'm not. It wasn't dirty or anything. I'm just
Yeah.
saying they asked for one. They get the cardboard. They squeeze a little bit of the rub in there because it's menthol. So think of menthol cigarettes.
Yeah.
Kind of tap the outer with coffee, and they just kind of like they either just kind of like with their hands, kind of like get the aroma of the coffee and
so like they're essentially
like
smoking it.
Yeah.
But just so you can get that menthol.
Yeah, and I don't know if isn't that
that's
crazy?
crazy. Yeah.
So I was just like, okay.
Because I mean, you've heard because I used to dip, right?
Yeah.
And it got to a point where it was more of just the feeling of
And just having it
the
in your
mint,
mouth.
the mint flavor in there, right? Like the little tingling sensation.
Yeah.
So I switched over to, I don't do it anymore, but like when I was trying to stop all of it, I did tea bags. It was called, I forgot what the brand was called, but it was tea leaves. But
Oh, it wasn't nicotine?
No, well, it had a little bit of nicotine in there.
Oh, okay.
And then, but it had like 10%, 5%, and 0% nicotine, right? So I would get the 10%, just like that's nicotine, but no tobacco, because it's just tea leaves. And then I would just slowly, all right, now I'm gonna go 5%. So I weaned myself off of the nicotine habit.
Yeah.
Which I mean, it could have been so much easier to just get a freaking patch or chew gum, but I was like, nah.
Yeah.
But I wanted that sensation of something there, right?
Yeah.
And so that makes sense about like they wanted that sensation of smoking a menthol.
Yeah.
But I just think that's wild.
So I just thought that was crazy.
You go in and girl, I need some tampons. Like, sure you do.
Yeah.
Sure you do, Linda.
And the whole time, y'all could see me on camera. I was like this, huh?
You're like,
And I was like, okay, I can see that, but hey, desperate times calls for desperate measures. Because that's
just saying, if you're trying to quit or a post-apocalyptic world, there's no more cigarettes. If you got tampon, you got some Bengay, there you go.
Sniff it. But it is. It's like menthol, menthol cigarettes. So I want to say shout out and kudos to her.
But dude, that's crazy. Like you, especially like from the prison systems, like some of these people who are in there for extended period of times, they actually find ways to for different stuff. Like we just talked about, like tattoo ink.
Yeah.
And then like now smoking just that menthol.
Yeah.
That's insane. And there's probably so much more out there that
I'll be
you're gonna experience that. You're like, dude, guess what? You can make a pot roast with just a bag of chips. I'm not saying like.
Yeah. So, anyways, I was like I said, I went behind the ears, but pretty soon I'm gonna know all the lingo and I'm gonna just know it all.
No, you told me. Remember, we're eating at grandma's, and you're like, "Oh, I'm learning the lingo because they said this." What was it?
Because this guy got a haircut, and I was like, "Oh man," because he had real pretty hair. I go, you cut your hair, dude? I said, "What's up with that?" He goes, "Oh yeah, because I'm catching chain," and I was playing it off like, "Oh, okay," and then I told the officer, "What is that?" He's He's going to prison. He's getting his time.
Oh, so that's what it means.
Yeah.
It's like when they say I'm catching chains.
I'm leaving. Yeah.
Oh.
And so I guess they shave. I think they shave you. I don't know how they do it. But anyways, he just went ahead and shaved his head. But I was like, and I played it off like, yeah, me too. Thinking like I'm gonna go get me a chain.
The dude's like, look at you like, you're going too?
You too, girl. But anyway, so I will be pretty soon on me talking the jail lingo on the podcast.
Dude, that's crazy. So let me tell you something. Have you ever had a patient, well, not really a patient, but I guess so patient, but patient or patient family ever just stare at you and be like, do you know what you're doing? You know what I'm talking about? You ever had that?
Yeah, and yeah.
Okay. So earlier this week, I was working and dude, this guy, he's been intubated for about almost 3 weeks. Mm-hmm. He had a perforated bowel, became septic, like A, B, C, D, E, F, G, right? They found out, oh, he also has cirrhosis. I'm like, it was just like you open a can of worms, right?
It was just sick.
Yeah, really bad. Anyways, so his sister was coming in to see him. And so he's been extubated already. Okay. So he's been extubated for almost 3 weeks now. Excuse me. He was intubated for about 2.5 weeks. He's extubated 2 days post when I got there.
Okay.
So he's already been post 2 days extubation, right?
And for people who don't know, that means basically
they took the tube out.
So
you're on your own breathing, right?
Okay.
And you're under a lot of drugs to keep you sedated throughout this whole process, right?
Yeah.
So a lot of times you will experience these. It's called ICU delirium.
Yeah.
Where you just don't know where you are. Like you're like, I don't know who. It's just delirium. Like thinking about like dementia, but it's delirium. It's just short term. It's just really quick, right? So anyways, she called on the phone. She's like, hey, I'm coming there. My plane's leaving right now at 9 something. I'll land about 11:30. Make sure you have the doctor there. I want to talk to him and I want y'all there. And we're like, yes, ma'am.
Yeah.
I don't know who you are.
Yeah.
But like you say you're a sister, but I don't know.
Yeah.
But we never met, right? But so all right, cool, whatever. And so she hangs up and I look at my nurse. I'm like, yo, what do we do? She goes, I don't know.
Yeah.
She's like, this is an ICU. Like, I'm not gonna go call doctor to come wait in here for her.
Exactly.
When they get here, we'll call if they want to talk to the doctor, right? So anywho, anyways, she finally gets there, finds out she's a CRNA. Okay. She's been CRNA for like 15 years. She's in her 50s or so around there. But I mean, she has that attitude of like my poop don't stink. Yeah. Or like I got my chip. Look who I am.
And the CRNA is
a certified RN anesthesiologist. So pretty much they're the ones that they do the job of anesthesiologists, which they make a lot of money. Don't get me wrong, they're very smart. It's very hard to get there, right?
But just throwing that title around, right?
Exactly. She comes in, she goes, hi. She goes, I'm so and so. She goes, I'm a CRNA. And what are y'all doing? I need the doctor right here right now. He needs a CT head scan right now. And we're like, I'm like looking around, like, are you talking to us?
You're like, oh, I didn't know you worked here.
I'm like, oh, hi, doctor. I never met you before.
Yeah.
No, she's in civilian clothing. Going wrong, she's dressed very, very nice. You know what I mean?
But like, she's not an employee. That's what you're saying.
She's not an employee. She's a family, but she's not even a medical power of attorney as well. She's just a sister. The daughter is a medical power of attorney.
Yeah.
But anyways, she's like, he needs a CT right now because he doesn't know who I am. He can't recognize her. I'm like, ma'am, he just got extubated 2 days ago. He's been under for over 2.5 weeks.
Which she should know. She should know, because that's what
like this
she helps do.
ICU delirium. Like it's possible he still is just trying to get bearings, right?
Yeah.
And the dude's sick. Like he's really sick right now. Like calm down. Dude he's really messed up, right?
Yeah.
Anyways, she's like, oh well, I need a CT head scan right now. I need you to go order one because he does not who I am. He could probably have a brain bleed, and we're like, okay. And so we leave the room, and I'm like, I look at my nurse. I'm like, what do we do? She goes, I don't know. This never happened to me before.
Yeah, yeah.
And so she calls the doctor. The doctor's right behind the door, so he comes in and goes, yo, I heard everything. What's up? She's like, yo, nurse. Patient wants this. Patient's sister wants blah, blah, blah. He's like, you know what? That's fine. Go ahead. Just do it. Just precaution, right?
Yeah.
Why not? Who cares?
Yeah.
So we had some time. So we got him, took me on CT, came back. 30 minutes goes by. We get results. Yeah. No impression. Everything's perfect, right? So we go to lunch. We come back and the sister's at the door, and where our station's at is right by the patient, right? And so we'll cross. So here's our station. Here's the room. Here's the lunch. The nurses like the lunch break room. We come out and we're walking back to put our stuff down. Her sister's right there, and she goes, "Hey, come here! I need you in here right now." And we're like, "Yeah, what's going on?" And she goes, "I need to show you how you reposition him and how you prop him up in bed." And we're like, "What?" Like, I know how to boost somebody up. Like, what are you talking about? Yeah. She goes, "Also, I need to show you how you suction him." And I'm like,
"You're like, I don't think you're supposed to touch that."
I'm like, "Ma'am, like we've been here. Like, I'm like, okay, so I know we're being polite. We're just listening." Yes. And I step out because I'm like, you know what, Stephanie, I love you, girl. You can deal with that. I'm gonna go put my stuff up. Yeah. So I grab her stuff to go put it up with mine. Yeah. And so I come back, and she's like, she comes in. She goes, "What have y'all been doing?" She goes, because you know what a spirometer is?
Yes.
It's a spirometer, for those that don't know. It's like a breathing machine. It's a little plastic machine. Yeah. You know a nurse invented that?
Really?
Yeah,
I think,
yeah. It's really cool.
And y'all have seen it if your mother had been in the hospital.
I wish I brought one.
You just hold it and you put the
breathe.
Tube in the mouth.
Yeah. So when you breathe in, it rises, and so you try to hit a goal, like how much you breathe it in. The whole purpose is to keep your lungs open to help prevent infection, because you're sitting in bed all day, every day, right?
Yeah, exactly.
Anyways, so yes, there is. You're supposed to do 10 an hour for every hour just to help, right? Yeah. It's like prophylaxis. Well, we're in ICU. Like, we have patients who are freaking sick, and we're not just our patients. Everybody works as a team. We're helping their patient. We're helping this patient. It's everything, right? Yeah. She's like, I've been seeing y'all just sitting down doing nothing for 3 hours, and I've been here for 3 hours, and y'all haven't come in here once to do that with him. And my nurse is like, if you've been here for 3 hours, like you could have helped. Like
you're
you
capable.
know.
You're a nurse.
Yeah,
also.
you're able to know how to do stuff, right?
Yeah.
And so we're like, okay, ma'am, and so we're checking him, repositioning him, and we see that he had a bowel movement.
Yeah.
So Steph's like, hey, let's change him quick. All
Yeah.
right. So we're getting ready. We're starting to change him, and she looks me dead in the eye. And she's across the room. I'm sitting there. I'm holding her
That's
brother.
when you should never make eye contact.
Oh my God.
With the enemy.
I had her on her side. I had the dude on his side, and Stephanie's cleaning the backside. And I'm like there, and a bam, eye contact. She goes, oh, you're a nursing student? I'm like, yes, ma'am. She goes, oh, that's awesome. That's awesome. She goes, so what's an incentive spirometer? And I'm like, and I'm kind of like dumbfolded. I'm like, what? She goes, what is it? And so I said, well, it's a little breathing machine that you can breathe to help expand your lungs to make sure you don't get sick. I mean, she goes, okay. She goes, so how does it work though? And I'm like, what? I said, she goes, how does it work? I said, and I know what she's trying to get at. So I was like, it helps open up your alveoli, whatever.
Yeah.
Plural, alveoli in your lungs to promote oxygen exchange, move the mucus, all the good stuff.
Exactly, yeah.
And I'm like, that's what it does. And she goes, well, what's it called? I'm like, it's called recruitment. That's that's the official term, what it does.
I bet inside her mind, she's like,
No, and she's like, okay, good. So you know how it works, right? So yeah, she goes, well, I need to make sure because apparently you don't because you haven't been here to do it with him. And I'm like,
and the mic dropped.
And she goes, and she's like, well, you're a nursing student. You should be here doing it beside him. She goes, where's your instructor? I didn't talk to them because as a nursing student, you should be doing that. And I'm like, what? Like, ma'am, like, no, like I'm assigned with my nurse. I have multiple patients I deal with. Yeah. Like this is an ICU setting. We have patients who are intubated. We have patients that we're running rapids on. Like we're not sitting down doing nothing.
And she doesn't. I mean, she should know you're with your. I mean, the instructors aren't there.
No, exactly. Well, it gets better, right? And so she's like, well, that's your nurse's job. She goes, you can come and teach him how to do this and do it with him. And I'm like, she goes, so where's your instructor? And I'm like, my instructor's not with me. She goes, oh, so you're here by yourself? And I said, no, I'm in my last semester.
Yeah.
I'm with my nurse. She's my preceptor. She goes, oh, so she's your mentor. I said, yes, I'm with her this entire time. I take on a full load of patients.
Yeah.
She goes, oh, okay. Well, she goes, well, you need to make sure that, you're coming in here and doing the stuff with him. Uh-huh. And I'm like, ma'am, first off, not to be rude, but you're not my instructor. Uh-huh. You're not my nurse.
Yes.
You're not a doctor.
You're a family member.
You're a family member, and you don't work here. Like, I understand, yes, we, everybody, every single patient should be doing a sense spirometer. When the heck do the nurses, will we have time to sit there with them to do this breathing treatment?
And I'm sure y'all do, but my thing is this. If there's family there, it goes for any setting, like any kind of a doctor's office or a hospital or nursing home. They're thirsty. Well, you can give them the cup. It's not like you have to pull the light and wait for somebody.
And like,
it's things like that.
Yeah, and then I'm like, it's not like we're sitting there on our asses, like playing games on a phone. Like, dude, it was a really crappy day. And then I think I told you we had an inbound on the helo on top of the pad. They had they airlifted somebody into us. Yeah. So I went with the nurse and to go help her get that patient from the top, which is really cool, by the way.
Yeah, seeing
airlife come in and then all the flight medics and the flight nurse come out. That was awesome. Anyways. Like that took a good hour of our time getting the patient, move the patient, transition the patient from the flight crew to our crew to getting the patient ready. We had to admit them, and she lays a GI bleeds, or her pressures are through the bottom.
I mean, that's why she's been airlife. She's critical.
Yeah, I'm like we're not just sitting here on our butts the whole time. Like I'm doing stuff, right? And so I'm like, yes, ma'am, you're right. But then sitting back and afterwards, I was talking to my nurse about this, and she goes, it really seems like she's angry, and she can't be angry at her brother because the brother, because even she was telling us that don't get me wrong, she was a nice lady. It's just the way she came off at it, like because it's very inspiring that she's a CRNA. Yeah, she's an African American woman. Yeah, that's a CRNA. Like that's something that's amazing. Yeah, she fought tooth and nail to get where she is.
Yeah, and it's very hard.
Exactly,
it's hard schooling.
Exactly, and so I'm like, I'll respect for her, but I'm like. Yeah. There's no need to be like that with us. But then like we said, she's probably very upset with her brother of what all this has been going on, right?
Yeah, and he's sick, and she probably thinks the daughter's not asking the questions she should
the
ask.
right questions. Yes.
Yeah.
And so, like it's, and so she can't take it out on him.
Yeah.
So she takes it out on everybody else. And even my nurse too, because she was like, well, how long you been here? How long you been a nurse? And she's like, well, I've been a nurse long enough and I know what I'm doing.
Yeah.
She goes, well, how long? 2 months? 3 months? and Stephanie was like, no, I've been here for almost a year. And she goes, oh, all right. And I'm looking at her, I'm like, dude, like, what is it? But then afterwards, we're like,
sad with
afterwards, we're like, you know
families,
what? She's just, she's directing anger elsewhere.
And
But yeah, so the running joke, because everybody on the nurse's station, they all know that family. They all know her.
They all knew what was going on.
Yeah, and because this happened, the dude's been there for almost a month. You know
okay,
what I mean?
so she's been, come down.
Yeah, and so everyone knows that's how she is, right? And so I came back to the nurse's station, and the charge nurse was like, so how was it? And I'm like, well, I said,
you could have warned me.
I pulled up the incentive barometer. I brought one. I said, well, I'm gonna go study this thing. I'll be back. Dude, they were just laughing. But I mean, the guy was making good recovery. I said he should make it. But yeah, I was just like, why are you acting like that? There's no reason to be like that with me.
I think every nurse has experienced that. The families can just be, and there's always that family has to throw their credentials around.
It's the family that has people in the medical field. Yeah, it's always like that.
I remember one time, Grandma, we were at the hospital or something, and I'm just an LVN, and I don't have ER hospital experience, but so I was sitting there, and then my daughter's a nurse. Well, that could be like anything from an RN/BSN. I could be a flight nurse, and I look at her like,
"Can you shut up?"
And then they go,
"You're like."
And I remember the lady goes, "Oh, where do you work at?" She's probably expecting me to say, University Hospital. And I said, "Oh, I work at a nursing home." And she's like, "Oh, very nice." But I looked at my mom like,
have you seen the TikToks when the nurses, the daughter is sitting there and she's like this?
Yes.
And they're like, "Oh, she's a nurse too." And she's like, "Shut up, Mom, shut up."
Because you know what? Because people, like us, you're just, I mean, you understand the terminology, but then again, when you're a nurse, you understand the flip side. Like, let them do their job.
Exactly. And that's what my charge nurse told us.
Yeah.
She goes, the thing that like you need to kind of set that boundary. You need to make that boundary known at the place. You're like, hey, listen, I know your family.
Yeah.
I know you have X, Y, and Z credentials. I know you know what you're doing. But at this moment in time, you are the sister, brother, whatever family.
Yeah. You
don't work here. You're not my colleague. You're not my doctor. You know what I mean? So it's like, I respect who you are.
Yeah.
But here, I'm for the patient, and here you're just family. So so don't forget that. And it's because one of the other nurses, nurses talk. Everyone was talking.
Yeah.
Well, one of them, she's very seasoned. She goes, because Stephanie is so new, just barely a year, and another girl's been there for almost 3 years. I mean, people are like, oh, I bet you people are like, oh, 3 years, that's not a lot. But in nursing world, it's like dog years, okay?
So really, she's been there 21 years.
Exactly. But anyways, no, she was like, and she told us that. She goes, y'all need to set that boundary and let them know, hey, listen, I respect who you are. I respect your credentials and what you have. But in this moment, you're not my colleague. You're not my coworker. You're not the doctor in charge. You're just a family member. And with all due respect, I need you to just let us do our job.
With the emotions invested in your loved one.
Exactly.
Yeah.
Because at the end of the day, we want the same thing.
Yeah.
We want the patient to get better. That's the bottom line. But I mean, it was really interesting because I've never been in that situation before. I've had, patients who were like, oh, you're a nursing student?
Yeah.
Just like, oh, right. Like, whatever. I don't care. I'm not here to prove anything to you.
And just remember, I mean, this is just the start. You're gonna, one day you might take care of that doctor like this, a cardiologist. The best.
I'm like this. I'm right there, like, all right, we're gonna do a quick EKG. He goes, no, I know what it is. I'm like, okay, my bad.
But when it comes down to it, I mean, they are the patient.
Exactly.
Yeah.
But so that was pretty interesting. We had a pretty good week. I mean, I go back to work tomorrow, so. I don't know. It might be even crazier after that. I'm really hoping to be chill. I'm really praying to God tomorrow's just a chill day. Because like I said, that day was like, because it was sad. And we had another patient whose the daughter was an ICU nurse, and she was coming in like, oh, well, where's his CBC? What's his WBC? Like she's throwing acronyms. I'm like, girl, just ask me what you want to know. I'll tell you. Like
you should have said, I haven't learned lab yet, and I'm gonna graduate.
I have, guys. Don't do that. But no, but yeah, I'm like, why are you throwing acronyms? Just tell me, like, hey, what's the blood looking at? What's her white blood cell? What's WC? What's the INR? What's the I need IS in here? I'm like, what? Girl, no, stop that. But anyways, have you heard? Okay, so Mike, I found that people said there's a shortage of nurses, right?
Yes.
There's not a shortage of nurses. There is a lot of licensed nurses out there. There's a lot of nurses who don't want to work because of the crap that the hospitals give.
That's what I hear.
The poor money. It's X, Y, and Z, right?
Yeah. Management, really.
Management, yeah. Right. So anyways, because New York City is dealing with a shortage of nurses not wanting to work, they are actually changing the nursing student clinicals like regulations.
Yeah.
So it says simulation labs, like in-house simulation, right?
Like with the
plastic bodies, dummies,
yeah,
could account for now as much as 30% of New York's nursing student clinicals under a new bill. So pretty much they're saying, because the whole reason for this is they're trying to push these nurses out as possible. They're trying to make nurses they're trying to stamp them. And, they want to take they want to reduce the time of clinical time, of actual in-hospital clinical time, and just transition it to more simulation in the labs so they can easily meet the requirement to graduate.
Maybe they don't want the nurses to go in the hospitals and start hearing the other nurses talk about crappy management.
Dude, I'm just saying, but like it says the bill was signed and now it's going to go into effect for spring 2024 semester.
Yeah. We know we're talking about that. So for example, like when you do a Foley catheter, and that is putting a thin tube.
Mom, it's not thin. It's not thin. That thing, it's like this thick. It's like this thick on this mic right here.
That. But what we're saying is, on the dummy, I'm just being honest. The hole's perfect. Yeah. It's right there.
It especially on a female patient that that urethra is right there.
And it's just insert the tube. But in the real world, you have a lot of body types. You have older people.
You're like, yo, where's it at?
Yes. And so. And like when you do draw lab, a lot of them have
IV,
they have the veins already.
Yeah, it's a perfect veins.
It's not a drug addict coming in with the veins blown or an old lady dehydrated. So it's gonna be kind of a shock for them because they know the basics, but unless you're like you're their clinicals,
it's experience.
Yeah. Or when you change somebody, even the basic, I'm gonna change. And on a dummy, on a real person. If you're by yourself, some body types, they might be fragile. They might be this big guy.
Oh man.
And so that's what clinicals really.
So pretty much what that's saying is, don't do nursing school in New York. I'm just gonna say it. I'm just out there.
Yeah.
But if you know what, if you have to do nursing school in New York City, or New York City, but New York, get hired on as a nurse extern, get some more experience because they're not gonna give it to you out there.
Because they're trying to roll you out like a car like a Ford factory. Next.
Oh man, well I don't know about you, but I've had fun. This has been really good. So it's nice to get off of my chest of the BS that I got because most of y'all understand where I'm coming from. Y'all have had that situation before. So what? Yeah, maybe I should go and read about spirometry and know how to use it. But I know it's called.
Maybe I should roll my own cigarettes
with meth.
Oh, you know what?
Bengay.
You know what? Real quick, this man, he's an older guy. He's an officer. He told me he worked in the prison system. So the little free Bibles they give you, like the little Gideon ones. He said what he would experience was a lot of the inmates, and I'm just like mind blown. They would save their spinach if they had spinach day from lunch or dinner, and they would put it out to dry, and then they would get a page from the Gideon Bible because the paper's like those soft rope, and they would roll their spinach,
and they would smoke that.
Well, I don't know how they would get that, but I'm just saying.
And they would smoke it.
Yeah, and I'm just
they were smoking John 1:1.
Yeah, for God so loved the world. But anyways, I'm just like, it's crazy. It's a whole different world. Prison,
Oh man,
the jail prison. But I thought that was crazy.
dude, I can't wait to next week to see what happens next week with y'all. Well, to end it off on us, I just want to say a quote that I heard that I really like is, "Don't be afraid to fail. Be afraid to not try. Be afraid to not try."
I like that.
Yeah, because like I said, I mean, you never know until you try it. Just do it.
I always laugh and tease Noah that where I work now, because you kind of yourself, like we do everything because you're a jail and no one. Anyways, we do everything but an ultrasound or X-ray. We get those people coming in.
Yeah.
But we do lab. Well, I'm from a nursing where we don't draw labs. Like during COVID, we did. They wouldn't come. Long story short. I mean, like Noah kind of gave me a crash test one day, we're doing it. And so the other day, Noah was like, "Did you do some labs?" We had a lot of them. And I said, "Dude, I just went for it. I just said, I'm going to do every one that comes in here and I'm going to try."
And that's how you learn.
And that's how
you learn. Just doing it. Yeah.
And it's funny because the inmates are looking at me like, and I look at them and I'm like, "You're my first one." I said that to this one guy. He was like, "I am?" I go, "Yeah, you're my first one. Congratulations." And I didn't get it. So let me get someone else. But anyways, go for it.
Yep.
Especially in nursing.
Exactly.
Go for it. It's how you learn.
Exactly. Well, guys, thanks for being with us.
Happy Easter.
Happy Easter. God bless y'all. And we'll see y'all next time.
Bye.